This week on The Cone, we're talking about one of the scariest emergencies that can happen to dogs. It's gastric dilatation and volvulus, also known as GDV, even more commonly known as bloat. I think we can save some lives with this episode. Let's get into it.
And now, the vet who sometimes has to talk about things that aren't super funny, Dr. Andy Roark.
I'm making this episode because yesterday I lost a patient to GDV. It was horrible and I don't ever want to see it again. I know that's not possible, but I'm hoping that we can minimize the chances of that happening to you, and I would love to do anything I can to decrease the incidence of this disease. So, without further ado, here are 5 things you need to know about bloat. People use the terms bloat and GDV interchangeably, like they're the same thing. To be completely honest, GDV is bloat plus an additional very bad thing. Bloating or gastric dilatation is when the stomach expands beyond what is normal. Pressure that builds up from this can pinch off blood that's going to the stomach or returning to the heart. So that's the bloating part. The really scary bad part happens if the swollen stomach rolls over. That's volvulus. And it causes big important vessels to be tied off so that there's no blood going back to the stomach or to the spleen. They can die. When this happens, if this happens, most pets go right into shock. The clamped off blood supply can cause problems in the heart like arrhythmias, which are irregular heartbeats. It can cause damage to the liver or kidneys or other organs. Guys, it can cause the intestinal lining to die and to slough off. If we get stuff like that, bacteria can get access into the bloodstream and patients can become septic, meaning they have infection in their blood. This is truly terrifying stuff. So the first step in avoiding this is understanding how it can happen. We don't fully understand the process whereby GDV does happen in pets. It is associated with big meals where we have food and lots of air from like gulping and swallowing, and they stretch or expand the stomach. At that point, the pet is not able to expel the gas or food, and we've got the bloated belly. There's an increased risk for this condition in dogs that have narrow, deep chests, like these breeds. We also have increased concerns for dogs that are male, that are older, that are stressed or anxious, that eat one big meal a day, that eat really fast, that eat from an elevated or lifted up bowl position, dogs that have had their spleen removed, dogs that are of large or giant breeds, or dogs that have been related to other dogs who have had this condition, so the relationship, or if you've seen this condition before, they have a higher chance of it happening again. Finally, in 2006, there was a study that indicated that dogs who were fed dog foods that have oil, like sunflower oil or animal fat, in the top 4 ingredients on the ingredient list may be predisposed to the condition. There is a way to pretty much make sure that GDV will not happen in the future, and that's a surgical procedure called a gastropexy. Essentially, it's putting, think of it as just putting a stitch in a certain part that holds the stomach and stops it from doing that nasty rotating over thing. This is not something that I regularly recommend, but for dogs that are high risk, this can make a ton of sense. If we're not going to do the surgery, and most of us are not, then we need to focus on feeding management for at-risk dogs. Feed 2 or 3 smaller meals a day instead of one big one. Avoid dog foods that have oils in the top 4 ingredients on the ingredient list. Discourage dogs from sucking down huge amounts of water really fast or inhaling their food. Minimize their ability to get out and run around and exercise for a couple of hours after they eat. And finally, just don't feed your dog from an elevated lift-up bowl unless they have another medical condition that makes that necessary. You can also try to slow down your friends eating with special bowls. So there are these food mazes and they have ridges and it looks like a maze for the dog's tongue, I guess. And you put the food in there and they kind of have to eat around all these little obstacles and it just slows them down. There are things like this. This sticks to the bottom of the food bowl, and again, it essentially just gets in the way, and so they have to eat around it and it slows them down. There are puzzles and games that you can put their food in, and they have to work the game to get their food out. And again, it's just about slowing them down. Classic toys like this, they can get some of their food, just load up with kibble. They have to work for it. Some people feed their dog with a muffin tin. It's honestly just about slowing them down. You've got tons of options in how to do this. The best one honestly depends on you and your dog and what works for them. The first signs are usually belly pain or abdominal pain. Signs that show you this is going on can be looking anxiously at their belly, stretching, standing, not getting comfortable. Drooling is a sign of nausea, retching, just trying to throw up and nothing's coming up. Those are the first things we're looking for. As things progress, they might pant, they might have obvious signs of bloating, like you can see a bloated belly. They may get weak or even collapse. If this happens, you may see their gums start looking blue because of a lack of oxygen getting there, and their heart rate can spike up, and it's tachycardia. There's no easy treatment for this, and time is working against us. If you think that you're seeing signs, do not wait. Get your dog to the vet. Call ahead and let them know that you're coming and why, so that they can get everything ready, and they'll be ready for you as soon as you walk in the door. Your vet will try to get the air out of the stomach to get the stomach down to a more normal size, and then go to surgery to untwist everything, make sure everything is okay, and they're gonna do the gastropexy I talked about earlier to make sure this never happens again in the future. This is an emergency surgery, and it's only possible if we take action and get to it very quickly. If things go well, we can still expect a dog to spend a couple of days in the hospital. The condition's that significant. From a financial standpoint, this condition can be devastating. Like, I'm just gonna be straight with you. The surgery is not gonna be cheap, especially if you go to an emergency clinic to get it done in the middle of the night. It's also gonna take a couple of days of recovery in the hospital. If this is a condition that your dog might be prone to, and it would be tough for you to get your hands on a couple of $1,000s pretty fast, think about pet insurance. Think about it early on so you have it way before you need it, because that's the only time it's really gonna make a difference. And that's our show. Guys, I hope you never need this knowledge, but I hope that you'll sleep a little better now that you have it. If you're someone who has had this experience, if your dog has had bloat or GDV, let us know in the comments if there's anything that you wish you knew beforehand, anything that might help other people, because that's what we're here for. Let's help people, let's help pets. Guys, take care. Let's be the people that our pets deserve.